back to Ask Endocrinologist channel. We are here again with another video, but today it's going to be very short and sweet. And the topic of our discussion is intermittent fasting. Are there benefits? Are there things that you need to do? And what exactly is intermittent fasting? So I'm going to quickly tell us what it means. Many of us already know. It's not new to us. You already been doing it. Or maybe you don't even know that your regular fasting period has been an intermittent fasting as well. So we're going to talk today about its benefits. And maybe there's some warning signs, things you should watch out for, so that you do it correctly. So what exactly it is? It's actually an eating pattern where you circle yourself between means of eating and fasting. And it doesn't specifically tell you what kind of food to eat and what not to eat. It just focuses on just what you eat. So you could have different method of your own intermittent fasting, and sometimes it could be in a day you are doing 16 hours of fasting and 8 hours of eating. What does that mean? It means your last meal for the day is at dinner time, and you don't eat until afternoon time the next day, meaning you skip breakfast. And the remaining 8 hours between 12 p.m. and 8 p.m., that's when you use to eat. So that is one method of the intermittent fasting. Another method is if you use 5 and 2 diets, meaning 5 days of the week you're eating, but you consume your normal diet, but then the remaining 2 days you decrease your calorie intake, or you just decrease like up to like 500 if you're a woman and 600 per day if you're a man. And this just for 2 days. And after 2 days, you go back to your regular diet and eat food. Another one is eat, stop, eat, meaning this involve like 24 hours or fast once or twice a week, whereby you are not eating anything from dinner of one day and then the next dinner of the other day. And this one, guess what, is the main one that many people do when they are doing Lent or fasting for religious purposes and to pray, meaning from 6 p.m. when you had your last dinner to 6 p.m. the next evening. And for the whole day, you're not eating. Another one is alternate day fasting. In this one, you alternate between your normal eating days and fasting days, where you either completely abstain from food or you just decrease your calorie intake. So this is like alternate day fasting. It's similar to like the 24 hours, but it's not completely 24 hours. So it's just one day you're not eating something and the other day no. The warrior diet, what does that one mean is when you're eating small amount of raw fruit and vegetables during the day and your large meal is in the evening. Like you could just munch on fruits and munch on raw vegetables, and then evening time, your dinner time is your main meal. So this typically just give you like a 4-hour window of eating. Are there benefits to this? Dr. Hope is here with me, and she's going to tell us more about what are these benefits and why is it important that we can be practicing this. And by the
Yes.
way, not for everybody. I'm sorry to
Yes.
interrupt you. It's not for everybody that should be doing. Kids, teenagers, old, elderly people, you want to avoid them doing it so that you don't deprive them of nutrition. Yeah.
Great. I wanted to add something, Grace. Thank you so much for that excellent explanation of the different types of intermittent fasting. I think the one that most people do is a 16/8, I believe. And that type of intermittent fasting, other than the people that do it for religious reasons, which is more like the 24-hour, but the people who do fasting specifically for health reasons or weight loss, the 16/8 seems to be the most common. And I just wanted to also add that 16/8 can be broken up any way you want. Personally, I've done the 8-hour 16/8 in that I eat between 12 noon and 8 p.m. So 12 noon to 8 p.m. I eat, and then after 8 p.m. To the next morning or next midday at 12 noon, I don't eat, only drink water. So yeah, so that's one way of doing it. But you can make that 8 hours any period of time you want to. But Dr. Grace presented the option of doing it from dinner time as well. So let me talk about what are the benefits of intermittent fasting. I think the most significant benefit is weight loss, right? And weight loss can occur because by eating within a specific time period, it limits our overall calorie intake and increases the duration of the fasting period. And it helps burn fat as the body shifts to using stored fat for energy when glucose stores are depleted. So it allows the body to shift to the fat source, and again burns that during that fasting time. And that's a very important way that really is significant in losing weight. So it gives the body time to actually burn that fat and burn those calories. Another benefit of intermittent fasting is improved insulin sensitivity. So this eating pattern, it could improve insulin sensitivity, which helps manage our blood sugars well, right? So for patients who have diabetes, of course, we say that you have to follow your doctor's advice, because a lot of if you're on insulin or any medication, even an oral medication for diabetes, you have to eat in order for it to work well and to avoid low blood sugars or hypoglycemia. So definitely check with your doctor. But the intermittent fasting can improve insulin sensitivity as well. Another benefit of intermittent fasting is brain health. So some studies have shown that it actually improves memory, and it may possibly prevent the development of Alzheimer's disease. So again, that is a possible benefit of intermittent fasting. It's definitely been shown to increase production of brain-derived neuropathic factor, which has been shown to be beneficial in learning and memory, as well as the generation of new neurons in the brain. Another benefit is cardiovascular health. So intermittent fasting can improve risk factors such as blood pressure and cholesterol, which can lead to better cardiovascular health. And finally, longevity in some studies have been shown to be associated with intermittent fasting. So those are some of the main benefits of intermittent fasting that have been shown in some in animal studies, and some in early studies to be beneficial in overall health. So thank you for that. So again, weight loss, improve brain health, improve insulin sensitivity, improve blood pressure and cholesterol, and increase longevity are some of the benefits of intermittent fasting. Back to you, Grace.
Thank you, Dr. Hall. Yeah. That was very thorough and interesting. I hope you can hear me because I'm
Yeah, we
trying to
can
go
hear
back
you
and
now.
forth.
Yeah,
Okay, yeah.
yeah.
So then, if this is very good, are
Mm-hmm.
there risk factors? Are there things someone should be careful of? All I can say is that, like I mentioned before, that if you have a
Good.
teenager, a
Yeah.
young person, you want to make sure that they are not being deprived of nutrients, because you could
Mm-hmm.
actually be deprived of nutrients because you're not eating more frequently as you would. And then it could also disrupt your social or lifestyle. If, for instance, you are in a gathering and you needed to eat and your life revolve around, social gathering, family dinners, and professional meetings, and all those can be disrupted.
Mm-hmm.
Other things is to watch out if you have any eating disorder, to avoid doing intermittent fasting, because it's not going to be very suitable if you are binge eating at the end of it, because you don't want to eat, and then at the end you're eating in a harmful way to harm your to not help your body at that
Mm,
time.
yeah.
Yeah. So in conclusion,
Mhm.
intermittent fasting is actually good, and
Mhm.
it's beneficial as we grow to try to do intermittent fasting at least once or twice a week. If you can
Mhm.
do it every day, like Dr. Hope said, 16:8 ratio is what most people do. So
Yeah.
if you can do that, that would be great. If
Yeah.
not, try to do one or two things, to help your weight loss
Yes.
and improve your insulin sensitivity, blood pressure
Mhm.
control, and all this stuff. We
Mhm.
hope you have enjoyed the video today.
Yes.
Like,
Yeah.
comment,
Yeah.
and
And
right.
yeah, and if you're interested in, in starting your intermittent fasting journey, there are many resources, on the internet that are available that will help you with your intermittent fast. So I definitely say it works. I've done it myself. It's been very helpful. So yeah, intermittent fasting I think is can be beneficial in several different ways.
Yep. All right. Thank you. And let us know if you like more of this video. Let us know so we can create more for you. Thank you and have a wonderful day.
Take care.